Woot 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 woot. I never thought I would be on the Mitt Romney show. When you were laughed out at the presidential race against Barack Obama, I just knew you would turn to Hollywood like I did. You know what I have always said. The people don't elect US presidents, God does. Anyway, Mitt, thank you so much for having me on your show. You and me are so much alike. We love ourselves. We say surprising and unexplainable things all the time, and we love money.
Well, thank you, Sarah. I think. Anyway, folks, so let's give a loud round of applause to my secret lover. Sarah Palin.
Thank you. Thank you. Thank you, my fans. Thank you. Thank you. Well, Mitt, I agreed to come on your show for 2 reasons. 1, I like to see myself on TV, and 2, I think it's time I tell you something very important, and I think you better sit down for this conversation.
Okay. Actually, Sarah, I want you to know that I recorded your tour across the country and secretly watched it on Friday night, so... Man, well, actually, Sarah, okay, I think I will remain in my seat because, well, I heard that I look smarter when I'm sitting, thank goodness. Yes, it is true. And also, I like pancakes and prefer to be seated when eating them.
So here's the thing, Mitt. In my professional opinion, as the former governor of Alaska and ex-vice presidential candidate, thank you, my fans. Please sign up for my fan club. And well, yes, Mitt, quite frankly, you are many things, but what I would like to tell you is, you are depressed, Mitt. And you are quite anxious as well. And I would like to recommend that you take a Celebz, commonly known as the happy pill or Lexapro.
OMG, Sarah, how did you know that I have a prominent and relatively persistent depressed or dysphoric mood that interferes with my daily functioning? I've lost interest in making money. I had to have 20 new suits tailored because of my weight loss. I have absolutely no interest in filet mignon anymore, and I can't sleep even after my nightly spa treatments. I'm even starting to feel guilty about the poor. And I'm feeling worthless even though I own the Cayman Islands. I'm also restless, keyed up, on edge, easily fatigued, irritable, and will I often draw a blank and my wife fills in the blank.
You know, Mitt, I often get depressed when I watch the news. The news makes me so sad that I just don't watch it. But I'll tell you a good look-in. It is generally agreed that acute episodes of major depressive disorder require several months or longer of sustained pharmacological therapy beyond response to the acute episode. But the recommended dose of Lexapro is 10 mg once daily. A fixed-dose trial of Lexapro demonstrated the effectiveness of both 10 mg and 20 mg of Lexapro, but failed to demonstrate a greater benefit of 20 mg over 10 mg. If the dose is increased to 20 mg, this should occur after a minimum of 1 week. Lexapro is well absorbed following oral administration with peak plasma concentration usually attained within 5 hours. If you have some caviar with your pill, it does not affect the absorption. The antidepressant effect usually occurs within 1 to 4 weeks and its half-life is 27 to 32 hours. Lexapro will be eliminated in your urine.
Well, Sarah, I heard that generalized anxiety disorder is recognized as a chronic condition. Dr. Oz recommended that I use a scalp massager. He told me it's a great way to relieve tension and stimulate blood flow. I had my wife in. Researched on the internet, and studies have shown that a scalp massage can increase the production of certain chemicals in the body, including endorphins and serotonin. Oh, Sarah, can Lexapro help me with GAD if the scalp massager fails me?
The efficacy of Lexapro in the treatment of GAD beyond 8 weeks has not been systematically studied, but the physician who elects to use Lexapro for extended periods should periodically reevaluate the long-term usefulness of the drug for the individual patient. The bottom line is that the recommended starting dose of Lexapro, I thought I stowed a pill to give you, but I cannot find. Anyway, as I was saying, the recommended starting dose for GAD is 10 milligrams once daily. Since I am the most awesome former governor ever. Yes, thank you. I would only recommend 10 milligrams per day for most elderly patients and patients with hepatic impairment. Oh, I am so sorry I get carried away with how completely awesome I am and just think I could have been your VP or Supreme Boss of the Senate. And yes, as I was saying, no dosage adjustment is necessary for patients with mild or moderate renal impairment. However, Lexapro should be used with caution in patients with severe renal impairment.
Sarah, I'm worried. What if it doesn't work or I need to stop taking Lexapro?
Well, MITT, symptoms associated with discontinuation of Lexapro and other SSRI and SNRI have been reported. Patients should be monitored for these symptoms when discontinuing treatment. A gradual reduction in the dose rather than abrupt cessation is recommended whenever possible. If intolerable symptoms occur following a decrease in the dose or upon discontinuation of treatment, then resuming the previously prescribed dose may be considered. Subsequently, the physician may continue decreasing the dose but at a more gradual rate.
Wait a minute, my wife Ann just ran over with some information for me on the cue card so I don't look completely ignorant. Lexapro is an orally administered selective serotonin reuptake inhibitor, or SSRI. Lexapro tablets are film-coated, round tablets contain an escitalopram oxalate in strengths equivalent to 5 milligrams, 10 milligrams and 20 milligrams escitalopram base. The 10 and 20 milligrams tablets are scored and imprinted with FL on one side and either 5, 10, or 20 on the other side according to their respective strengths. Lexapro can be administered in a peppermint oral solution of 5 milligrams. Man, that's neat information.
Mitt, there have been reports showing adverse events occurring during the discontinuation of Lexapro and other SSRI and SNRI or serotonin and norepinephrine reuptake inhibitors, particularly when abrupt, including the following: dysphoric mood, irritability, agitation, dizziness, sensory disturbances such as paresthesias-like and electric shock sensations, anxiety, confusion, headache, lethargy, emotional lability, insomnia, and hypomania. While these events are generally self-limiting, there have been reports of serious discontinuation symptoms. Mitt, you should be monitored for these symptoms if discontinuing treatment with Lexapro. A gradual reduction in the dose rather than abrupt cessation is recommended whenever possible.
My wife Ann, who currently drives only 2 Cadillacs these days, is more worried about the adverse reactions to Lexapro. In particular, she is concerned about my decrease in libido and also my impotence and ejaculation disorder. She also pointed out less important reactions such as insomnia, diarrhea, fatigue, and somnolence, but I had actually heard of some on my own such as dry mouth, increased sweating, dizziness, nausea, constipation and digestion, abdominal pain, influenza-like symptoms, appetite decreased, rhinitis, sinusitis, and well, if I were a woman, according to clinical trials, I would also be worried about anorgasmia.
Mitt, FYI, anorgasmia happens to men as well. And those side effects are not good, but they only occur in a small percentage of people using Lexapro. I think they might occur at a more increased rate if the dose is higher, which I imagine you will need. I'm sorry, Mitt, what was I saying? I got distracted by my image on the TV. Monitor, thank you, my fans. I love me so very much. I'm glad you agree and love me too. Thank you. Yeah, and well, yes, there is always an increased risk of suicidal thinking and behavior in children, adolescents, and young adults when taking antidepressants for major depressive disorder. Lexapro is specifically not approved for use in pediatric patients less than 12 years of age. But you don't have to worry about falling into any of those age ranges. However, the doctor would still need to monitor you for clinical worsening, suicidality, and unusual change in behavior, especially during the initial few months of therapy or at times of dose change.
All of this talk about Lexapro makes me want a stiff drink. And pancakes.
Well, Mitt, I hate to burst your bubble, but the use of alcohol is not recommended for people taking Lexapro. In fact, caution is also advised when Lexapro is co-administered with other drugs that may affect serotonergic neurotransmitter system, such as terpenes, linezolid, lithium, tramadol, or St. John's wort. Concomitant use with SSRI or SNRI or tryptophan is not recommended. If you take Lexapro, you should not take any other medicines that contain escitalopram oxalate or citalopram hyobromide, including Celebz.
Sarah, you are bumming me out, so I am going to have to ask you to leave now.
Hey. Peace out, Mitt. Just trying to help, lover. Well, call me later. Mitt, thank you. Thank you. Don't forget to join my fan club at www.sarahpalinforpresident.com or watch my new reality TV show about killing moose and other cute furry creatures. Wait a minute, that was cancelled. Anyway, I loved it.